Small business owners have for years railed against Obamacare, claiming it hurt their bottom line and made it very difficult to grow the companies. But will the new Republican health care plan work any better for them? Peter Suderman joins me, features editor at Reason Magazine. Welcome back, Suderman, Computerman.
Thanks for having me. Glad to be here.
All right, so let's talk about some of the economic aspects of the new health care plan that Republicans have put forth. Do you think it's better to have age-rated or income-rated tax credits? It's a trick question, so think carefully before you answer.
The correct answer is that it is better not to have refundable tax credits, which are effectively a subsidy, just like in Obamacare. The Republican health care bill just disperses them somewhat differently. It universalizes them. And so there's some advantages to that, which is that tax credits that are based on age are much easier to administer, because it's really hard to figure out what a person's income is going to be in the coming year, because incomes change. And so trying to figure this out, it's just a big challenge for the IRS. It doesn't do it very well. This is one of the reasons why we've seen a lot of fraud in the exchanges, and we've seen, or I should say that we have seen reports that fraud is quite easy and possible within the exchanges right now. And so this is one of the big problems with the Republican repeal and replace bill, is that it basically relies on the same fundamental idea about how government should interact with the healthcare system, which is that it should subsidize people and create an entitlement for the individual insurance market.
Yeah, it's interesting because you talk about the individual insurance market, but an even bigger part of that, of course, is Medicaid expansion, and that was a necessary part of Obamacare and a big sticking point. So how do conservative House Republicans and moderate Senate Republicans square Medicaid expansion at this point?
That's a good question. Right now, there is not an awful lot of agreement amongst Republicans. So what the House bill does is that starting in 2020, it converts Medicaid into a per capita block grant. So a block grant typically just is sort of a set amount of money given to states. This would make the set amount of money based on the number of people in the program, just in case the number of eligible people changes over time.
Okay, but
and so there's folks in the Senate who want Medicaid to basically continue, maybe even to be more generous. There's folks in the House who actually want to see the Medicaid reform part of this plan kick in a little bit earlier, because there are worries that if it is delayed until 2020, it becomes like the doc fix. Remember that, which basically every year it was this thing that just got kicked down the road, and was nothing was ever really done about it.
Yeah, and it's really interesting because obviously you have a very different audience for Medicaid than you do for Medicare, and older Americans tend to vote, and that's why Medicare is pretty stable. But why, I guess, what is the assumption that we should be putting more people on Medicaid? Is it just that the program already existed and it's a convenient way to shove a bunch of uninsured people under a larger umbrella?
So the AHCA, the Republican repeal plan, doesn't put more people on in the long run. What it does is it basically allows states to continue to expand the program if they want up until about 2020. And then after that, says that people who are already in the expansion, the Obamacare's Medicaid expansion, because remember, a big part of Obamacare was expanding Medicaid. People who are already in it get to stay in it so long as they don't go off of the program. And so it kind of slowly rolls people out of the program, provided that it actually goes into effect.
Yeah, you know, maybe just push them out. It's so inhumane. So let me ask you about the reactions. Paul Ryan says that he's encouraged by the CBO report. The White House is pushing back on it. Who do you think has the more genuine reaction at this point?
Honestly, neither of them. I mean, Paul Ryan